Hi, everyone. Welcome back. This week, we are going to be talking about crisis intervention and the use of brief therapy and crisis intervention techniques. So, unfortunately, traumatic events and acute crisis episodes are super prevalent in the world and continues to be a significant concern. There's a high likelihood you'll end up working with someone who has experienced an acute crisis or is experiencing one. Not all crises are the same and they utilize different approaches, but brief therapy techniques is extremely useful in addressing crisis situations. So let's start off by understanding what a crisis is. So, a crisis can be defined as a period of psychological disequilibrium experienced as a result of a hazardous event or situation that constitutes a significant problem that cannot be remedied by using familiar coping strategies. Now, not everybody who goes through a traumatic event or hazardous situation is going to need crisis intervention, but a significant amount of people can and will. So some people will experience a crisis reaction. A crisis reaction refers to this acute stage, so right after a hazardous event occurs. During a crisis reaction, people can present with helplessness, confusion, anxiety, shock, anger. That being said, what someone views as a crisis is really subjective. So a subjective reaction to a stressful life experience is important to note that, the crisis is not the situation itself, but rather the individual's perception of it in response to the situation. Either way, when a situation is considered a crisis by that individual, it affects their ability to cope and function, and it's an opportunity for intervention from a trained clinician or mental health professional. So there's been several systemic practice models and techniques for crisis intervention that has been developed over the years. I'm going to highlight the ones that are most applicable to brief therapy. So we're going to talk about the ACT intervention model, which stands for assessment, crisis intervention, and trauma treatment. The Roberts 7-stage crisis intervention model is included in the crisis intervention section. We're also going to touch briefly on crisis intervention psychotherapy, which is more or less a companion or follow up to psychological first aid. So, the ACT model. As with any effective treatment model, it's important to facilitate an initial assessment of the needs of the client. This is especially true for people who've just experienced a traumatic event or crisis, which they typically aren't prepared for. Assessments can come in different forms and with different protocols. So, triage assessments are typically utilized by frontline crisis intervention workers. So, possibly a therapist working um, with the National Suicide Prevention Hotline could use a form of triage assessment. The goal of triaging is to make an immediate decision in which the mental health professional determines lethality and referral to appropriate care alternatives, such as maybe outpatient treatment, hospitalization, social support, or possibly no referrals at all. Another form of assessment utilized is crisis assessment. So the primary goal here is to evaluate an individual in a crisis state so that the therapist can help resolve the crisis. In a crisis assessment, you're really trying to make informed decisions for treatment based on the individual, their immediate environment, and interpersonal relationships. Lastly, but just as importantly, are biopsychosocial and cultural assessments. These can take a little longer and are recommended for a client is stabilized and not in the middle of an acute crisis. They're more in depth and help determine treatment goals by assessing various domains of functioning. After the assessment process, the clinician would move towards providing crisis intervention strategies. So these strategies should be time limited, and goal oriented. A useful framework for crisis intervention guidelines is found in Roberts' 7-stage model of crisis intervention. So, stage one focuses on planning and conducting crisis and biopsychosocial assessments where lethality measures are included. Stage two is establishing rapport and rapidly establishing a therapeutic relationship or alliance. Stage two and one are kind of done simultaneously as you're working on actively building rapport during the assessment process, anyway. Stage three involves identifying the issues pertinent to the client and any participants to the client's crisis contact. This is where you might use some solution-focused therapy techniques, such as scaling questions, exception questions, coping questions, and so forth. Stage 4 involves helping the client deal with feelings and emotions by effectively using active listening skills. So using lots of reflective statements and emotion labeling. Stage 5 is generate and explore alternatives by identifying strengths of the client as well as previous successful coping mechanisms. By this point, you've hopefully established a strong rapport with the client, and you want to help them identify strengths and resources they already possess. And stage 6 involves using these strengths, resources, and supports you've identified with the client and implementing them in an action plan. The idea here is not to be restrictive when creating the action plan with the client, but really empowering the client to take the lead on identifying coping skills, their resources, safety plans, support systems, etc. Stage 7 involves establishing a follow-up plan in agreement with the client. The therapist should plan to follow up with the client and assure that the crisis is resolved and identify the post-crisis status of the client. And then the T stands for trauma treatment. This might not always be needed following a crisis, but crisis can be aligned with traumatic events, right? So the majority of individuals who are exposed to traumatic events experience some trauma symptoms, but never develop PTSD. Trauma treatment can be needed, and trauma symptoms should be assessed for after a traumatic event. Lastly, we'll touch on crisis intervention psychotherapy. Now, this is an underutilized form of therapy that can be facilitated during psychiatric disasters and emergencies. It became frequently used during COVID-19. So, crisis intervention psychotherapy, or CIP, is problem-solving, solution-focused, trauma-informed, and time-limited. It uses a systematic or a family-centered approach. The downside to this model is that it hasn't been manualized and it's not systemically studied as a potential evidence-based psychotherapy for treating crisis. Its effectiveness was based on the collective face validity of this treatment being used in mental health settings. So its use came about because of the immediate need for crisis treatment while COVID-19 was going on. It's considered more of a wisdom-based treatment modality and definitely leaves room for more systemic study and research on the model. With that caveat, crisis intervention psychotherapy utilizes well-known and effective tools, such as an ecological map, a problem-solving treatment plan, and eclectic psychotherapeutic techniques with an individual or a systemic focus. So CIP is a brief therapy and it's ideally delivered on a 6-week timeline, but can last from 2 to 20 sessions. Sessions range from weekly to 2 times per week. It can be conducted as individual therapy or with family and couples. So variations of CBT may also be offered concurrently with CIP. The initial intake phase can last or take 1 to 3 sessions and involves identifying the precipitating events towards the crisis and then helping identify the client's strengths. Clinicians can help the client create an eco map or an ecological map, which helps the client and clinician gain an understanding of the client's social support and resources in their environment. The crisis mid-phase involves identifying maladaptive defenses, coping styles, problem-solving skills, and finding ways to mobilize the client's strengths. A lot of times mental health apps are used as an additional support. So apps such as Zavelo, Quit That, Headspace, those sort of things. Termination is the last phase and wraps up the therapeutic relationship. Typically, there is an action plan with clear steps that follow that, follow-up care, and crisis resolution strategies. All right, and that is all about that today, and I will talk to you all soon. Take care.